Assalamu alaikum. Today I am here to discuss about an anti-obesity drug which is known as Orlistat. There are my group fellows which present this drug. But first we will discuss about what is obesity. Obesity is the excess accumulation of fats in a body that causes many diseases like diabetes, hypertension and many cardiac issues and many diseases because obesity is the mother of any disease. So there is an introduction of anti-obesity drug which is known as Orlistat. Orlistat is an anti-obesity drug. Orlistat is a novel anti-obesity agent that inhibits dietary fats absorption. It is a potent and slowly reversible inhibitor of gastric, pancreatic and pancreatic carboxyl ester lipase. The drug is licensed for the patient with a BMI greater than 28 kg, but decision should be based on the individual case. It is a semi-synthetic hydrogenated derivative of the natural occurring lipase inhibitor produced by Streptomyces toxotrichini. So there is a chemical structure of the Orlistat which is 2-formyloamine 4-methylpentonic acid. Its empirical formula is C29H53NO5. Behind the history of Orlistat, Roche Pharmaceutical Company has introduced Orlistat at the end of 1998 in UK. It was the first compound in a new pharmacological class that limits dietary fats absorption. In April 1999, Orlistat received Food and Drug Administration approval for obesity management, including weight loss, weight management, and when used in conjunction with reduced calorie diet. Here is the pharmacokinetics of Orlistat, which include liberation, absorption, metabolism, and excretion. Orlistat taken orally. Orlistat acts mainly through local effect in GIT and minimally absorbed from GIT tract due to lipophilic nature. Greater than 99% bond to plasma protein, which is mainly albumin and lipoproteins. Metabolism form M1 and M2 metabolites which have no pharmacological activity. Complete excretion take almost 3 to 5 days. The half-life of absorbed Orlistat is approximately 1 to 2 hours. Let's discuss about the mechanism of action. Orlistat covalently bonded to serine residue of active sites of lipases and inactivates them, reversibly inhibiting gastric and pancreatic lipases, prevents the hydrolysis of triglyceride and thus free fatty acids are not absorbed. Orlistat inhibits dietary fat absorption approximately 30%. There is a visual representation of Orlistat mechanism of action, how it works in the body. Let's take a glimpse on clinical manifestation. In lean human, Orlistat decreases fat absorption by 20% and 35% when administered in low and high doses respectively. High doses did not decrease fat absorption above than 35%. The recommended dose of Orlistat is 120 mg. Studies stated that Orlistat administration with low calories diet and exercise reduced the weight 0.5 kg per week. There is no serious adverse effect have been reported during Orlistat therapy. Recently, in a short-term study, revealed that Orlistat have several mild GIT adverse effects, which includes diarrhea, oily spotting, inhibits the absorption of fat-soluble vitamins and flatulence. Hence, the Orlistat is a safe drug to use. There is a toxicity profile. Incidence of nephrotoxicity manifesting as acute oxalate nephropathy, Orlistat-induced pancreatic insufficiency and steatoria. The FDA received reports of liver problems associated with Orlistat uses. Beside all these possibilities, which are minimal, Orlistat is safe drug. For example, there is a report of overdose with 5,160 mg Orlistat in 28-month-old baby. The patient did not experience any adverse effect. Orlistat has no drug-drug interaction. The most of drugs either having narrow therapeutic window or taken specifically by obese, such as hypertension, antidiabetics, and cardiotonic medication. Orlistat had negligible or no effect on serum hormones such as insulin, thyroxine, and catecholamines. There is a contraindication of Orlistat, not for use under the 10 years old children, not used in pregnancy and maternity period, contraindicated in chronic malabsorption syndrome and cholestasis. These are the available brands like Orlistat, Orlisum, and Xenical available in market. That's all for. It is an overview about an anti-obesity drug which is known as Orlistat.